According to the CDC, between 2015 and 2017, 65% of women between the ages of 15 and 49 in the United States were currently using contraception. And experts say there are more women who would like to, but they do not have access to that health care. That's why Maine now is looking to expand that access with a new bill by offering birth control without a prescription from a doctor.
News Center Maine's Jackie Mundry explains how it would work.
In 21 states and Washington, D.C., women are able to go into the pharmacy to be evaluated and eventually prescribed a contraceptive.
We would certainly not be among the first, but we wouldn't be among the last.
This isn't the first time Maine has tried to pass a similar bill. 6 years ago, Senator Eric Brakey first proposed this. At the time, the committee decided to wait for guidance from the federal government on how to move forward and make birth control more accessible. But there hasn't been action in the last 6 years, so Brakey is proposing it again.
This is a common sense way we can get government out of the way to increase access to birth control for women.
The Maine Society of Health System Pharmacists is advocating for this bill to pass. It says healthcare is already challenging to access for many people.
Pharmacies represent one of the most accessible forms of healthcare.
Matthew Marston is on the Society's board. He says this would work for things like the birth control pill, patch, or insertable rings. But other birth control that needs to be administered at a doctor's office, like an IUD, wouldn't be available. He says this would make life a lot easier for women looking for contraceptives.
Many women live closer to their local pharmacy than they may the next available healthcare facility. So it works to remove barriers in access.
Our pharmacists are already there to consult on things like this. We're just taking one extra step out of the process.
No one testified against this bill on Thursday. And now that the committee has heard from the public on the topic, it will head to a work session. Jackie Mundry, News Center Maine.
Pharmacists in Maine are already prescribing some medications, including naloxone for people who are at risk of overdosing and Paxlovid for patients with COVID-19.